Jason Evans, one of the physician assistants working here at Utah Valley Dermatology. Today we're going to be doing a circular biopsy. We do a biopsy to determine, what a specific lesion is. If something's looking suspicious, we can take a small sample of it, send it to a lab, get it processed, then have it looked under the microscope, and this will determine exactly what the lesion is. Today we have our patient here. He has a suspicious lesion on his cheek. We've already marked the area that we're going to biopsy. And before we do the biopsy, we clean the area off with some alcohol. This keeps the area clean, minimizing any risk for infection. And then we always numb the area up before doing the biopsy so the patient doesn't feel anything. This involves a small injection with some lidocaine. That lidocaine contains some epinephrine, which can help control any bleeding that may occur after the biopsy. When we do our injections to numb the area, we like to use a little tool that causes a little buzzing and vibration around the area. This will help distract the nerves in the area so the patient doesn't feel the discomfort from the needle as much. In this instance, we'll use a small tool that'll take a small sample of the section in the middle of the lesion, and then we'll let it heal by secondary intention. We can remove the tiny area that we did the biopsy from and place it into our specimen jar. We did our circular biopsy. Now we'll be placing a small stitch to help bring the wound edges together. Here's after the biopsy with it stitched in place. As you can see, the wound edges have pulled together nicely. The whitish color surrounding the biopsy is due to the epinephrine within the lidocaine that we use to numb the area. That causes the vessels to constrict and should last for about an hour to an hour and a half. We just did our circular biopsy. There are a variety of other biopsies that we could do determining on the type of lesion, one of which is the shave biopsy. This is utilized by you taking a small scoop of the lesion. Generally, we can keep it flush with the skin and do not need to have a stitch to help those heal. They generally heal fine on their own. Specimen will now be sent to a lab and then looked at under a microscope to determine exactly what the nature of the suspicious lesion was. Patients can expect to have their results back within 1 to 2 weeks and will receive a phone call from one of our trained medical assistants as regards to what the lesion came back as. If you have any other questions or any spots that you are concerned with, come find us here at Utah Valley Dermatology. Thank you.